Hi, I'm Dr. Koo, and today I'm going to place an implant on our patient's upper right side. I'm going to show you where. If you come closer to the screen, you see a gap between these two teeth. That's where I'm going to place an implant. And most of the time, when it comes to posterior teeth, I usually do it without a guide. But today I'm going to do it a little bit differently. I'm going to use what we call an X-Guide. It's a new machine that we acquired recently. And placing an implant with an X-Guide is like driving with GPS navigation. It maximizes your precision and also minimizes any kind of guesswork. When I'm placing an implant without a guide, there's a little bit of guesswork involved because I have to look at things from multiple angles. When I'm drilling into the site, I have to look at it from multiple angles, and then also I have to take some x-rays to see that my trajectory is right. But with an X-Guide, I don't really have to worry about any of that. With the X-Guide, I get to see where my implant drills and implants are going. So I get to see the depth, I get to see the angulation, and if I'm off, I get to see by how much. So obviously the goal of placing an implant is to replace a missing tooth. So the implant will take care of the root part, and then we have to place a crown to make sure that the patient has a functional tooth. So with implant crowns, there are two ways to keep the crowns in place. One method is through the screw, so we call those screw retained crowns, and the other kind is called the cement retained crowns. So whenever possible, we aim for a screw retained crown because there are two major issues that we see with cement retained crowns. One is that if there are any cement residues, those can cause a lot of issues around the implant and the gum tissue. And secondly, if we ever have to remove that crown, we essentially have to destroy that crown. That's the only way to remove it. On the other hand, with the screw retained crowns, if we ever have to remove it, we just unscrew the crown and then it's easier to take it out. So for those reasons, we aim for screw retained crowns, and we want to make sure that we place implants such that we can deliver the screw retained crowns. With the X-Guide, I can plan the future crown and also the future implant such that the screw channel comes out right in the center of the future crown. Many times I can achieve this even without a surgical guide or X-Guide, but it's just less predictable. So as you can tell, I love this machine, but there's a steep learning curve. I'm not used to just staring at the computer screen and operating because I'm used to looking inside of a patient's mouth and do the work. And secondly, if there's any kind of deviation, those deviations get magnified on the computer screen. So I'm getting used to that. With that said, I'm going to show you how an implant placement is done with an X-Guide, so stick around.
For most of my implant cases, I open the gum tissue to expose the bone underneath. The one exception is when I'm placing an implant right after pulling a tooth. In those cases, I can often skip that step. Some surgeons using X-Guide do all their cases without opening the gums, but for me, opening it up is my go-to approach. This patient had a large infection around the tooth, and the tooth itself was too damaged to save. After I removed it, I did a procedure to preserve the bone in the area, and we let it heal for 6 months before coming back to place the implant. Now, we are ready for the implant surgery, and I'm using X-Guide to help me. Before I start drilling, I need to make sure everything is calibrated properly, and that's what I'm doing in this step. From here, I just follow the plan. As you can see, I'm watching the computer screen the whole time to make sure I'm exactly where I need to be. The screen shows me my angle and how deep I'm drilling. I use a series of drills, gradually widening the opening until it's the right size for the implant. With each drill, I keep going until the depth indicator changes from yellow to green. That's my signal that I've hit the right depth. Then, I place the implant, again, using X-Guide to guide me. I got really strong grip on this one, which is a great sign. It means the implant is solidly anchored in the bone. Once it's in, we close everything up with stitches. Here's the scan we took right after the surgery. Let's compare the plan to what actually happened. Take a look.